Welcome. This video contains useful information about the pediatric rotavirus vaccine. It was developed for healthcare providers working at Indian Health Service, tribally run, and urban Indian healthcare facilities. My name is Dr. Jasmine Curry Thomas. I'm a member of the Navajo Nation and resident in family medicine. I'm partnering with Native Boost to share this presentation with you today. For those of you who may not be aware, Native Boost is a project at the Northwest Portland Area Indian Health Board dedicated to sharing accurate, high-quality childhood vaccination resources with Native people and their medical providers. To access Native Boost's patient education tools, you can visit www.nativehealthresources.com, click on the Resources tab, and filter resources by the Native Boost campaign. Okay, let's get started. Today, we will discuss essential information about rotavirus disease, rotavirus vaccine, and current vaccination recommendations for children and infants. I will also share useful talking points you can use when speaking with parents and caregivers. Finally, I will offer some additional resources. Let's take a few minutes to discuss rotavirus disease. Rotavirus is a viral infection first identified in the 1970s. It is the leading cause of severe gastroenteritis and diarrhea among infants and children globally. Prior to vaccination for rotavirus, over 500,000 deaths occurred annually worldwide. Since the introduction of rotavirus vaccine, the number of deaths annually has been cut by more than half. Rotavirus is transmitted by fecal-oral contamination. While there are strains of rotavirus that infect other animal species, for those strains that cause disease in humans, we are the only host. Typically, the infection period begins about 2 days before the onset of symptoms and lasts throughout the time of acute illness. Most rotavirus infections are symptomatic and resolve without medical intervention. Some cases are more severe and require emergency or hospital care. Immunocompromised children may have more severe and prolonged illness. Symptoms of rotavirus commonly include fever up to 102 degrees Fahrenheit, severe dehydration, diarrhea, electrolyte abnormalities, and metabolic acidosis. Now let's take a moment to discuss the ins and outs of the rotavirus vaccine for children and infants. Two rotavirus vaccines are available for use in the U.S. RV5 or Rotatech and RV1 Rotarix. Both vaccines are live oral virus vaccines. RV5 and RV1 vaccines contain no adjuvant, antibiotic, or preservative. Notably, RV1 vaccine oral applicator contains latex rubber. Both vaccines have demonstrated high clinical efficacy in randomized trials. For RV5, efficacy against rotavirus infection of any severity was 74%, and against severe rotavirus gastroenteritis, efficacy was 98%. For RV1, the efficacy of the two-dose series against any rotavirus gastroenteritis was 87%, and against severe rotavirus gastroenteritis to age 1 year was 85 to 96%. Additionally, the efficacy against hospitalization for rotavirus gastroenteritis was 96% through the second season after vaccination. A meta-analysis of population studies in the U.S. found the vaccine effectiveness for a full series against the combined outcome of emergency department visits or hospitalization for rotavirus disease was 84% for RV5 vaccine and 83% for RV1 vaccine. This chart shows the percent reduction in hospitalization in the U.S. for two time periods, 2008 to 2011 and 2012 to 2015, compared to the baseline period before routine use of rotavirus vaccine. In the U.S., the incident in rotavirus hospitalization is higher in odd season, the blue bars, compared to even seasons, the orange bars. In the first time period, hospitalization decreased by 36% in odd year seasons and 59% in even year seasons. For the more recent time period, 2012 to 2015, the decrease in rotavirus hospitalizations compared to baseline was even more dramatic, 75% in odd year seasons and 90% in even year seasons. Furthermore, the gap between odd and even seasons appear to be closing as fewer infants remain at risk. Both vaccines have demonstrated safety in clinical trials. For RV5, increases compared to placebo were most commonly seen for diarrhea 18.1% versus 15.3% and vomiting 11.6% versus 9.9%. Less commonly seen were slightly increased rates of otitis media, nasopharyngitis, and bronchospasm in the vaccine group compared to placebo. For RV1, compared to placebo, increased the rates of irritability 11.4% versus 8.7%, Cough or runny nose, 3.6 versus 3.2%, and flatulence, 2.2% versus 1.3% were seen. The rates of any severe adverse events, including death, were similar in vaccine and placebo recipients for both vaccines. With the prior rotavirus vaccine, RotaShield, released in 1998, there was an increased rate of interception of about 1 case per 10,000 recipients after the first dose. This increase was only identified in the post-licensure phase and resulted in the vaccine being withdrawn from the market in 1999 within 1 year of its release. Current vaccines were intently studied for this potential complication. Large phase 3 clinical trials of both vaccines with over 60,000 participants did not identify any cause of interception. Pre-planned post-licensure surveillance in multiple countries identified a small risk of interception. In the US, this is one excess case per 20,000 to 100,000 recipients and appears to be highest in the first week after either the first or second dose. When it comes to vaccine recommendations, to ensure vaccines are safe and effective, vaccine recommendations are continuously updated based on new information from disease surveillance systems like the National Notifiable Disease Surveillance System and the Active Bacterial Core Surveillance System, the Vaccine Adverse Events Reporting System, or VAERS, as well as the Food and Drug Administration, vaccine manufacturers, and independent researchers. The CDC Advisory Committee on Immunization Practices, or ACIP, is the body that reviews this data and determines the recommendations published in the CDC immunization schedule. ACIP is a group of clinicians, researchers, public health experts, and at least one unaffiliated community member that meets at least 3 times per year. ACIP meetings are open to the public to increase transparency and public trust regarding vaccine recommendations. When it comes to rotavirus vaccine, the CDC immunization schedule recommends routine vaccination of all infants without a contraindication is recommended. The 2-dose series of RV1 vaccine is recommended at ages 2 and 4 months, and the 3-dose series for RV5 vaccine is recommended at ages 2, 4, and 6 months. Both rotavirus vaccines may be started as early as age 6 weeks. The maximum age for the first dose is 14 weeks, 6 days. The minimum interval between doses is 4 weeks. The maximum age for any dose is 8 months, 0 days. Note, these age maximums represent off-label recommendations by the Advisory Committee for Immunization Practices, or ACIP, for both vaccines to harmonize the dosing schedule for both vaccines with minimal impact on safety or efficacy. The labeled maximum age for RV1 vaccine is 24 weeks, and the labeled maximum age for RV5 vaccine is 32 weeks. As with any vaccine or medication, those who have a history of severe allergic reaction to a vaccine component or following a prior dose of vaccine should not receive the vaccine. Latex rubber is contained in the RV1 oral applicator, so infants with a severe allergy to latex should not receive RV1 vaccine. Some experts recommend that infants who are at high risk for acquiring latex allergy, such as those with spina bifida or bladder exstrophy, should receive RV5 instead of RV1 vaccine. Another contraindication for the rotavirus vaccine is a history of interception. As discussed, there is a small risk of interception with the vaccine, so any infant with a history of interception should not receive the vaccine. Finally, severe combined immunodeficiency is a contraindication. This is because rotavirus vaccines are live vaccines. As such, patients with severe combined immunodeficiency, or SCID, should not receive rotavirus vaccine. Patients with moderate or severe acute illness, including gastroenteritis, should defer vaccination until symptoms improve. In patients with immunodeficiency other than SCID, providers and parents should carefully consider the risks and benefits of vaccination. Conditions with limited safety data include infants with HIV infection and infants with pre-existing chronic gastrointestinal conditions. You may have thought during this section on vaccine recommendations, wow, this is getting a little complicated. If only there was an app for that. Well, there is. The CDC Vaccine Schedule app is a great resource for rotavirus and other vaccine recommendations. It is available for download for free for both iPhone and Android phones. The app is continuously updated with the latest immunization schedules for children and adults. It also includes catch-up schedules for people who may be under-immunized, as well as the most recent information on vaccine precautions and contraindications. To recap thus far, we have discussed rotavirus disease and rotavirus vaccines, as well as current vaccine recommendations for infants and children. Now we will discuss strategies for talking with parents and caregivers about rotavirus vaccines and vaccines in general. Notably, suggested approaches and talking points are based on research conducted by Native Boost. In 2024, Native Boost conducted 11 focus groups to gather the thoughts of tribal community members and healthcare providers and clinic staff in the Pacific Northwest. In the end, we spoke with 58 providers representing 12 tribal and 2 urban clinics and over 44 tribal community members from across the region. Through speaking with community members, we learned that they want to learn the basics about what the disease is and why vaccines are important via face-to-face conversation with trusted medical providers. Thus, when educating parents and caregivers about rotavirus, it is important to take time to discuss what rotavirus infection is, as well as the potential consequences of not vaccinating against it. Something to keep in mind when speaking with Native patients is that it is vital to use clear and concise language and to avoid using medical or scientific jargon. During talking circles, many parents and caregivers expressed that they did not understand or relate to medical or scientific terminology. To avoid making their providers feel like they were being challenged, parents and caregivers commonly said they avoided asking questions about concepts or words they did not understand. So, as a provider working with Native people, when you use medical or scientific jargon, you are missing an opportunity to effectively communicate valuable information to your patients. When it comes to speaking with your patients about rotavirus infection and potential consequences of not vaccinating against it, consider saying something like this. Rotavirus is an infection that spreads easily. It can cause severe diarrhea, vomiting, and fever in children and infants. It spreads easily among family members and kids at child care centers. Thankfully, there are vaccines that can help protect everyone. Then consider letting parents and caregivers know just how effective rotavirus vaccines are by saying something like, I let all my patients know that the rotavirus vaccines are effective. Before the vaccine, around 55,000 to 70,000 children in the U.S. were hospitalized with rotavirus each year. After the vaccine became widely available, those numbers decreased by 80%. Based on Native Boost research, one of the topics Native parents and caregivers were frequently interested in was vaccine safety, particularly as it relates to Native people. To address parents and caregivers' concerns about rotavirus vaccine safety, make sure to let them know that since rotavirus can result in serious health issues, we have been regularly vaccinating kids against it in the U.S. since 2006. Since the rotavirus vaccine was approved, millions of Americans have safely received the vaccine, including American Indians and Alaskan Natives. Make sure to remind your patients that serious reactions to vaccines are uncommon by saying something like, if you feel hesitant about vaccinating, keep in mind that serious reactions to vaccines, like the rota vaccine, are extremely rare. You're more likely to get hit by lightning than have a severe reaction to any vaccine. Based on Native Boost research, it is important to normalize mild side effects. Make sure to emphasize that after receiving the rotavirus vaccine, like any vaccine, children may experience mild side effects. Consider saying something like, when it comes to the rotavirus vaccine, common side effects may include mild GI symptoms like diarrhea or vomiting, and mild upper respiratory symptoms like cough or runny nose. Mild side effects are a good sign that your child's body is preparing to fight rotavirus. Within our body, each of us have warrior cells, also called antibodies, that stand guard and attack diseases. Vaccines like the rotavirus vaccines help our warrior cells see and fight disease. For example, when we get the rotavirus vaccine, the ingredients in the vaccine tell our warrior cells how to recognize and fight against rotavirus. Sometimes when our warrior cells are preparing to be able to fight, they cause mild side effects. These side effects are not a sign of illness. They're a sign your child's body is getting prepared if needed to fight rotavirus in the future. Most mild side effects usually go away within a few days. If anything seems unusual or you are unsure, call the clinic. We can help. To summarize thus far, we have discussed the importance of educating parents and caregivers about the basics of rotavirus, including what rotavirus infection is, as well as the potential consequences of not vaccinating against it. Based on our research, we emphasize the need to use clear and concise language, void of medical and scientific jargon. We also offer language that can be used when discussing rotavirus vaccine effectiveness and safety, and the need to normalize the experience of mild vaccine side effects. Now we will discuss strategies for sharing culturally resonant messages with parents and caregivers that center a Native perspective. Something tribal community members said would encourage them to get their kids vaccinated when asked about effective messaging around vaccination. They commonly express the desire for providers to emphasize the benefits of vaccination from both an individual and community perspective. To do so, consider reminding patients that vaccination protects their child and others in the community. Also, remind parents and caregivers of their responsibility to care for one another and for generations yet to come. Finally, make sure you present information about vaccines in a way that honors parents and caregivers' autonomy and individual sovereignty. This includes providing information about vaccines in a non-judgmental, empathetic way that affirms parents and caregivers' experiences while sharing accurate information. As medical providers, it's critical to listen to patients' concerns, take time to share basic information about vaccines, answer questions, address myths, and accept that parents and caregivers have the power to determine the right choice for their child and family. To enhance your knowledge about rotavirus and other vaccine-preventable diseases, there are a few resources I'd like to share. First is the Epidemiology and Prevention of Vaccine-Preventable Diseases, also known as the CDC Pink Book. This comprehensive manual provides detailed information about vaccine-preventable diseases and all vaccines on the CDC immunization schedule. The most recent edition was published in 2021. Since then, however, there have been changes made to the schedule. To ensure you have the most up-to-date information, make sure to check the CDC 2025 Child Immunization Schedule. The CDC 2025 Child Immunization Schedule can be found on the CDC's website or accessed on the CDC Vaccine Schedule app. Finally, if you would like to access culturally resonant patient education materials offered by Native Boost, visit www.nativehealthresources.com. Also check out www.indiancountryecho.org/boost for additional trainings for medical providers working at IHS, tribally run, and urban Indian healthcare facilities. Thank you for watching this presentation. Together we can increase the number of Native kids who are protected against rotavirus and other childhood illnesses.